turning to Inonge, who is a member of the technical committee for the CSO Debt Alliance in Zambia. Inonge, building on Robert's analysis, and I mean, Robert has given us a detailed analysis of what has happened in Zambia and how the Common Framework has failed Zambia to date. I really want to ask you then to provide us with a framing of what this has really meant for women, girls, and the environment and community in Zambia, because feminist research tells us that women, girls, and the environment ultimately bear the cost of this. And then I think Robert and Isaac really spoke to the conditionalities attached to this process. And then also we know how negatively austerity measures impact women and girls in particular. Could you provide us some insights into what this looks like from your work as technical advisor for the Debt Alliance? Thank you so much.
Thanks, Riska. I'd like to start by thanking Robert for laying such a good foundation, because it really gives excellent context to the impact that the debt restructuring process has had on women in Zambia and across Africa, really. Zambia being the first country to adopt the G20 framework, it really creates a foundation for the rest of the country, for the rest of the continent. And you see this trend beginning to reel its ugly head across the continent. We have to understand that debt distress is not gender neutral. When a country is under debt distress, what happens is that every single resource goes towards alleviating that distress. Every single penny, every single aspect of the fiscal space goes towards alleviating the external and the domestic debt services that arises from that distress. So what happens is that when we've seen that the G20 architecture has prioritized creditor coordination, and this has not taken into consideration gender responsiveness or social protection. It's not accidental that as the Zambia's struggled with debt, social spending and spending on the health and education sector has gone down. It's also not coincidental that as debt rose over the past 5 years, so has debt servicing. More than a quarter of our public budget goes towards debt servicing. And at the same time, that has constrained social spending. We've seen social spending struggle over the past 5 years. And it's a shame that the trend has even persisted, even in the climate, the allocation that's gone to the environment. Over the past 5 years, we've seen that Zambia has struggled heavily with climate catastrophes and climate crises, but we still see that the allocation going towards environmental protection has never exceeded 2% over the past 5 years. And that's saying something. It's forcing government's hand. For the past 2 years, I think, we have also seen that there have been supplementary budgets that are been dedicated towards addressing the impacts of the climate catastrophes that we've been facing, and also trying to supplement social sector spending. That shows that just gives us a small inclination towards the impact of debt on the communities. But when we look at the impact that it's had on women and girls, you see that it's even worse. When you look at reproductive care, the burden on women and girls is massive. Poverty often trickles down from the way we treat our women and girls. And as we've seen, with the reduction in social spending, the reduction in healthcare spending, and the struggle to maintain education spending, women and girls are not really prioritized. When it comes particularly to healthcare, women have to travel even further distances just to make sure that their children and their relatives are able to receive healthcare services. When it comes to social protection, women and girls who are unable to find work have to bear the brunt of having to leave school, leave opportunities in tertiary education to try and find a way to make ends meet. We all have somebody, or we ourselves are people who were sponsored by our grandmothers who had to sell in the market. That is an example of how poverty hits women and girls. Beyond that, budget freezes and cuts during prolonged debt negotiations hollow out facilities. So what you have is clinics that are unable to treat the reproductive and maternal health needs of women and girls. And that doesn't just affect women and girls, it affects men too. It means that men have to raise children on their own when their wives die during birth. It means that sons grow up without their mothers. They grow up without that very, very important maternal care in the first 5 years of their lives. And we know that male children are more vulnerable in the first 5 years of their lives. So they need that maternal care. And when mothers die, it falls on the extended female relatives to take care of those children. So we see how it dominoes beyond just the impact on women. When it comes to education, we see that there's a disproportionate effect on young girls as girls drop out of school to take care of the household. Even in sectors such as mining, where we're unable to truly allocate enough towards environmental protection, climate protection. We're unable to allocate enough towards addressing the catastrophes stemming from mining accidents because most of our resources are going towards addressing our debt burden. It means that women, the wives of the miners, the daughters of those miners are left with the burden of taking care of those people who are not being protected due to insufficient social protection. And the mining sector and all other sectors, the industrial sector, all of that, we see it stemming into those sectors. People lose their jobs due to the macroeconomic instability, and we do not have a robust enough social protection system to protect them. That means that all that unpaid care work falls on the burden of women. Unpaid care work has skyrocketed as poverty has increased, and as I said before, that is not a coincidence. It means that working mothers are unable to even progress in the workplace. It makes them less productive within the workplace, and it compromises our productivity as a country. Water services have weakened, meaning that women and girls in areas that that do not have access to clean water have to walk longer distances, meaning working women in those areas will reach work late as they also have to take care of their kids. And even for the men who are going out of their way to make sure that their wives are supported, it adds that extra burden onto them because it means that they have to supplement an income they have to supplement a household in what is basically a two-income economy right now, right? You can't really survive in a one-income household. And you see how it dominoes and affects everyone. The increased cost has also pushed households into survival mode. With inflation rising and the social services shrinking, you see that women take on multiple roles, and you have that triple burden that we often hear in the CSO space of women having to be mothers, they have to be caretakers, and they have to work, and so on and so forth. And it has created this feminized poverty trap of sorts, where women are unable to escape poverty because they have less time to work for paid opportunities. There's more unpaid labor, and they have worse health outcomes. And it's really a sorry state. And with how the G20 Common Framework is slow and creditor-centered, it says that there's no social protection, no gender analysis, and no requirements to safeguard the health and education budgets. Zambia is one of the few countries that applied for this framework, and the reports confirm that negotiations have been inconclusive. Mr. Mwaipopo mentioned at the beginning of this that we are not at 100% yet. These negotiations started late 2021, early 2022, and now we're going into an election year, and we're seeing that it's still at about, the last I checked was 94%, and that last 6% is going to take more of a toll than the first 94%. So we might see all of these effects worsening because we are focusing so heavily on creditor negotiations rather than trying to even out the burden that this effect has had. To conclude very quickly, AFRODAD has released several reports on the impact of debt. And I said before that about 25% or higher for the past 5 years has gone to debt servicing. But when you account for arrears and other similar domestic debts, it goes to close to a third of public budgeting. And with that little space, with that little room, and with the fact that we're going into an election year, we're going to see the government prioritizing election outcomes such as roads. Women are going to face the burden of that again because we're not going to look into the long term. And we might be getting another IMF package, which will also reorient the goals of our government. They're going to want to focus on stabilizing the macroeconomy. It's often at the expense of our social outcomes, yet again affecting women and girls. So hopefully, as we go forward, as we advocate in whichever space we're in, the private or public or civil society sectors, we can we will be able to understand that this affects every single one of us, male, female, or in between. And I hope that we understand just how dire the situation is.
Thank you so much, Inonge, for that. I think it is, there's a lot of research done on Zambia, the case study, AFRODAD, CTPD, and also, newspaper articles. There's a lot of literature available on it, but to hear the impacts from you firsthand is also like very interesting and telling. And I think when we look at the G20 of this year, I know on the sidelines of the Financing Common Summit, for example, the African Leaders on Debt Initiative had also then used that opportunity along on the sidelines of the first uh, finance ministers meeting to again demand, for the urgency of debt restructuring and looking at the issue more urgently. And I think throughout this year, there has been this common recurrence of raising the alarm and saying we need solutions urgently. And I think, in the past year also we've seen scholars come out with the idea and the concept of the depletion of care work. And I think when you're saying that last 6%, we're thinking of that last mile and how it's really maybe in that last mile, the depletion of care work, of women's reproductive care work, unpaid labor in Zambia. And we know also how um, visible outputs are really prioritized during election years. So it'll be interesting to see what happens next.